Hey, good afternoon, everybody. I guess we're into noon already. So thank you for attending this webinar, Going to the Hospital Alone, a Family Toolkit to Prepare for the New Normal. We welcome you all, and especially the people who are visiting from outside the USA 500 clubs. We're excited to have you all here today. Before I provide an introduction, please note that we have posted 3 documents for you to print out that will be very helpful to you while following along with our presentation. So, Jeremy, have we been able to post those yet?
We have, Rich. They're all up.
Okay, so if you go into the chat function down below and pull that up now, you'll find those 3 documents. I encourage you, especially, we're going to get started with the Family Toolkit checklist first. So go ahead and print that out. You can download it as well. And then we'll be going to the Vial of Life one very early in the webinar, followed by the most form and instructions. So these are 3 essential docs for you to have that would be handy while we go through this. Okay, so as a point of introduction, my name is Rich Wallner, and I am the proud facilitator. Oh. Someone needs to be on mute.
Go ahead and mute. I'm going to mute everybody. Rich, go ahead and unmute yourself after I mute everybody.
Okay, here we go again. All right, my name is Rich Wallner, and I'm the proud facilitator for the Elder Care Consortium, a subcommittee of the Special Needs Elder Care chapter. We represent the outreach part of this chapter and are a collection of various professionals who deliver various services to the elder care world and their families. We are a peer-driven, conflict-free roundtable where we host seminars and now webinars, plus we field inquiries from in and out of USA 500 clubs who need specialized advice on how to handle all types of challenging situations. Education and qualified advice is our objective and our mission. On our panel today is Joan Harris and Audrey Zabin. They are aging care life professionals, also known as geriatric care managers. Jerry Zismore, a daily money manager, who's also doing our technical side of the Zoom meeting today. Christina Badoli, who is a special needs and elder care and trust attorney. And Olga OKT, who is a financial advisor just like me. So on to the topic at hand. COVID-19 has created a new normal. Per the CDC, almost everyone who goes to the hospital must go there alone, meaning no family and no advocates allowed. This violates everything your mother ever told you: don't go to the hospital alone. But that is precisely the situation we are in today and for the remainder of the year, most likely. So what can you do to prepare your parents, even your adult children, and even yourself for a higher probability risk of going to the hospital alone for any reason, not just COVID-19? Our goal today is to provide you with practical advice on how to, 1, prepare a hospital go-to bag with the essential information your medical staff needs, even if you cannot speak up for yourself, plus a list of personal items to make your stay more comfortable. We also want to prepare you to create a Me Team Incorporated, a team of remote advocates and decision makers who can act on your behalf remotely when you cannot. We want to prepare you to identify the essential medical, legal, and financial information you and your team need to know ahead of time before you go to the hospital alone. And we're going to follow up with discussing issues before you get discharged. What are your rights as patients? And if you can't go home, where do you go and how do you make a choice on that? So hopefully we will end our webinar with a few minutes of Q&A, which can be transmitted through the chat function. So again, I refer you back to the chat function down below. If you have questions, feel free to put those out there. We're not going to answer those during the presentation, but at the end of it, we're going to try to, if we have time, kind of summarize them and put them together. Or you can contact us directly and I'll tell you more about that. So thank you for joining us for this important, timely, and relevant practicum so you can prepare for the new normal and protect the ones you love. So we're going to begin with the most important document, and this is that family checklist that I asked you to print out, and this is what it looks like. So we're going to prepare you for the go-to bag, and this may be the most important thing you take from this webinar because you can start doing this tonight. So let me introduce one of our panel today, Christina Badoli. Christina Badoli is an estate planning attorney who specializes in elder law and special needs planning. And I have known Christina for years. She was actually the attorney we hired to do the estate planning for my in-laws. and I've known her for a long time, and she's has also gone all the way through my family and friends who have had issues, and so I have great trust in what Christina has to say. So Christina, please start us out.
All right, thank you very much, Rich. Right before the pandemic really hit us here in Massachusetts, I was hospitalized for 4 days after giving birth to my second daughter via cesarean section. So pregnant women know that they have to have their hospital bags packed, and there's so many sample checklists out there for us to look at, and there's warnings about not having it packed early enough, because it's not a matter of if we're going to be going to the hospital, it's a matter of when it's going to happen. So during the pandemic that we're currently facing, we believe it's even more important for families to have that same level of preparedness. Now's a good time to kind of look at our go-to bag that's in front of you, our checklist for your go-to bag. And halfway down, you'll see there's feel-good items listed and different articles of clothing. These items are so much more than just making you feel good, and can make all the difference when you're confined to a hospital room. While we don't necessarily recommend someone sick bringing a laptop, for me, that was something that I needed. I needed my computer, I needed my files. So I planned that ahead of time for when I went into the hospital, because I knew I was going to be alone there, and it was something that was comforting to me to have. So if there's a possibility you or a family member who could get very sick and be alone in the hospital, it makes a world of difference to have these items with you. Now, going back also to our checklist, the very first section talks about an essential medical information folder. Now, this is a very easy folder to put together while you're healthy, and will make an incredible difference not only to the sick patient, but also to the sick patient's family members as well. The first item listed is a document that Audrey Zabin, one of our amazing aging life care managers on the panel, provided us with. And it's a 2-page document that's designed to speak for you during a medical emergency and provide the necessary information to help your loved ones, first responders, and hospital providers at the hospital give you the proper treatment or care. So it includes any medical conditions, current medications, emergency contacts, insurance, and even your hospital preference. So as with all the forms that we're mentioning today, these are living forms, which means they're going to be evolving and changing as your circumstances change. So this form is critical, and along with this form, it's very helpful to have a copy of your driver's license and your health insurance copy of your health insurance cards, and it's very important to be sure to include a copy of your power of attorney, healthcare proxy, and HIPAA releases. The key word being copies, because you want to ensure that the originals stay with the agents that are going to be helping you through this time, and that the originals don't get lost in the shuffle. So although I mentioned that the violates form does include a place to put your preference for where you would like to go, what hospital you would like to go to. During the pandemic, someone's first choice is often unavailable, and that first choice is probably where they usually receive care. So knowing this, knowing that no visitors will be allowed except in special circumstances, and that it's likely that you're not going to be able to see your regular doctor in person, and maybe only talk to them over the phone, it's even more important to have this essential medical information folder complete and in hand during this COVID-19 pandemic. Even though my hospitalization at Beth Israel was planned, there was still so much information that I had to exchange and provide and confirm. And with unplanned hospitalizations, it's just that much more information. The last thing anyone wants to be doing is communicating their medical history, insurance information, when they could have prepared it in advance. So it's not only on admission that all this exchange of information occurs, but it's throughout your stay at a hospital. So with so many providers that may be changing due to change in concerns or work shifts, it's just so helpful to have this medical folder with you by your bedside at all times. And I can't stress that enough. So Jeremy's now going to talk about some of the other sections on our checklist for your go-to hospital bag.
Thank you, Christina. That was very good. Jeremy Zismore is a daily money manager who helps people to pay their bills, manage their bank and credit card accounts when they lack the capacity, desire, or time to do so themselves. Daily money managers serve older clients in their clients' homes and open mail and can see for themselves what is happening, which is reassuring for their families who do not have an opportunity or even a desire to do so themselves. So Jeremy, here you go.
Thanks, Rich. So I'd say part of being somewhere unfamiliar for any indefinite amount of time is gaining a sense of comfort and regaining familiarity so that the mind can rest. And there are 5 categories we discovered that should help: clothing, feel-good items, electronics, daily living devices, and what definitely not to bring. So for clothing, with unpredictable temperatures in the room and potentially medical equipment to maneuver, we recommend you bring a few items such as warm socks and sweatshirts to keep you warm. Bring clothes you feel comfortable wearing and that have buttons or zippers for easy on and off. Feel-good items are a few necessities that can help you stay positive and connected and feel like yourself. So these would be books and magazines, prayer cards, a framed picture of a loved one, and we specifically said framed so it can stand up easily on a bedside table or windowsill. And then some personal items like toothbrush and moisturizers and shaving supplies when you don't want to have a big beard, and a water bottle. Electronics, you won't add your cell phone until the very end and the last thing you pack, but remember that hospitals can be loud. So noise canceling headphones allow you to step out of that environment, even if it's for just a couple of minutes. We recommend placing the electronics in a see-through labeled bag to keep the items together and make them tangle-free from the other items in the bag. Daily living devices are so important. You should bring the hearing aids and glasses so that you can read and hear what is being said. Lastly, these items that we would like you to leave at home. It's important that items of value, and especially this was one that surprised me, but the other panelists told me that prescription medicines are something we should not be bringing to the hospital. House keys and car keys are better left at home so that the people in your life who need to take care of those things when you're in the hospital have access to them. So making sure you have some items of self-care can make a big difference in your mental well-being and allow you to have some control of the situation. I'm now going to pass it off back to Rich, and we're going to talk about the Me Team.
Great. Okay, thank you, Jeremy. So if you're following along in your printout, there was one page that was your go-to bag, and then if you flip on the other side, it's the Me Team Incorporated. And the Me Team is basically you're assembling a team of people who you trust and know, who can speak for you if you can't speak for yourself. And we'll think of the real situation of we have elder parents who maybe haven't contracted COVID-19 yet, but may over the next year because it's not probable, but it's predictable that that could happen. And you need to have a team that can make really hard decisions. And so to do that, for that team to be prepared, you need to have a meeting with them. You're basically the CEO of the Me Team Incorporated, and you need people seats at the table who are going to represent you when you can't represent yourself. And so that's what this is all about. So to do that, the aging care life professionals, I'm going to introduce both of them. Audrey Zabin is the founder and president of AZA Care Management and Home Care, a care management and care managed home care practice in Boston, who also serves the North and South Shores and Metro West. Audrey, together with her associates, brings several decades of care management experience in finding optimum short and long-term care solutions with a thoughtful, compassionate, hands-on approach, building plans of care that support the needs, dignity, and quality of life her clients are looking for. and she is joined by Joan Harris, who is also an aging care life professional, formerly, which I mentioned before. She's a founder of Symphony Care Management, a concierge elder care consulting firm, also in Metro West and Greater Boston. She's an advanced professional and nationally certified, and she provides assessments, implements both short and long-term plans, crisis intervention, COVID-19 family planning, medical coordination, and has a specialty in Alzheimer's care and caregiver coaching. So both broad sets of experiences. So let's start with Audrey, who will start to take us through the Me Team Incorporated medical information. Audrey.
Thanks, Rich, and good afternoon, everyone. As Christina mentioned earlier, the Vial of Life is a form that we created years ago that it really addresses in a very cohesive fashion all the medical information that one would need if they were unable to speak for themselves while they were in the hospital. What is, I think, important for you to know with this Vial of Life is that all of the information that you have on this form should be going to your Me Team Incorporated and be in your own file when you take it to the hospital. It's a living document, which means that it needs to be updated. So a good rule of thumb is every time you have a medical appointment, you review the existing material in that Vial of Life. Whether it's a prescription change or a provider change, it's important to include those, because I think one of the things that's bared out with this COVID-19 that you don't always get to go to your hospital of choice, the hospital that may have your medical records. So it's important to keep these together. And lastly, I want to underline and emphasize that allergies are very important to keep updated. If you are unable to speak for yourself, medical treaters are very hesitant to treat without knowing if you are allergic to anything such as penicillin. So having your allergies updated regularly is also very important. You will also see today that we are looking at a medical document called the MOST. In the state of Massachusetts, we recognize this document for advanced directives. MOST is short for medical orders for life-sustaining treatment. And as I said, in our state, we recognize this. You should also know in Massachusetts that EMT drivers recognize this form and have all been trained to go look for it in your house, typically posted to your refrigerator. So at some point, I would urge you all to make a copy of this. They actually, if you read the directions, they'll tell you to post it in pink, to print it out in pink, because in fact, the drivers are trained to look for a pink sheet of paper. And so you print it out, you review it with your primary care physician, and just leave it on your refrigerator with your Vial of Life. And that's your real go-to packet for the hospital. Your Me Team will have a copy, your EMT driver will have a copy, and you will have a copy with you. You should also know that COVID-19 has really had an impact on the MOST documents and advanced directives. I can tell you as a former hospice social worker and, well, a longtime care manager, that I've seen some real changes in advanced directives during COVID-19. You know, I recently had an 82-year-old vet who was who's living in a nursing home and went to the hospital. And he was intubated and extubated twice. Now, if he were 28 years old, I would think nothing of having someone intubated and extubated twice during the COVID-19. But at 82 years old, the residual effects of that kind of procedure is very different. So I urge you to discuss this form, as by law, I think we have to, with your doctor or your licensed clinician. But I can assure you that COVID-19 is going to begin to have a ripple effect on our treatment, our emergency treatment, our advanced directives treatment. So it's worth considering and discussing. I mentioned earlier that I am a longtime care manager. And I must tell you that one of the lasting effects of my profession is the amount of discomfort families, adult children, and their parents have on discussing their health care, their advanced directives. And as a care manager, I'm very sensitive to the fact that this type of conversation can be very delicate for families. Yet we all know that who do we want being our advocate is typically a family member. So it's incumbent upon us to find a way to have these kinds of very difficult conversations. So I'm going to hand this over now to my colleague, Joan Harris, who has some supports and some tools, more tools for the toolkit, so you can prepare if you go to the hospital alone. Thank you.
Thank you, Audrey. Hi, everyone. So making informed decisions, for many people, having conversations with their loved ones about what their wishes would be for the end of life care, or even thinking through these things, is not something that most people want to do or they want to face. As care managers, we often are the ones promoting that our clients do this and give them the tools to work with through these difficult conversations with their families. The world pandemic of COVID-19 has made this difficult task all the more important, as we've heard. The family support tools we have been provided with the handouts, which you'll get at the end of this session, give many different websites that provide step-by-step guides to assist you in the facilitation of these conversations with your families, as well as with your medical providers. It will give you examples of what are the questions you want to ask, because you look at the MOLS form and sometimes it's hard to know even where to begin. All these pieces put in place will give you and your loved ones tremendous peace of mind that your wishes would be followed if, I always say God forbid, the worst case scenario were to happen. In Massachusetts, many aging life care professionals like Audrey and I have been trained by organizations like Honoring Choices to assist with this process. Care managers can be found in your zip code all over the country. So if you have family members across the country and you need support, all you have to do is go to aginglifecare.org and plug in a zip code, and you can find an expert to help you with this process. So the handout list will be given to you of the websites that are excellent in helping you with these conversations. I also want to add another resource that isn't on there, the Go Wish game. And this is the CODA Alliance. It's very inexpensive, and they're little cards that you can play. And I've done this with clients that actually can help start those conversations. So lots of resources available.
Great. Thank you, Joan. All right, so next we want to go back to Christina to go over the legal more details in the legal documents. So Christina.
All right, thank you. You know, in the same way that social distancing and heightened hygiene are steps that you can take to avoid COVID-19, there are steps that you can take to mitigate the harsh realities of poor estate planning or no estate planning. So having a sound plan in place is so important during this COVID-19 crisis, more so than ever. And people often think that the most important document that they have to have is their will or even a trust. Ensure these documents are important, and they ensure that your assets are going to be distributed to the right people after you die. But what about protecting yourself while you're alive? There are 3 very important documents that everyone over the age of 18 should have in place. And the first one that I'm going to talk about is a durable power of attorney. This is a document where you're appointing one or more people to stand in your shoes and handle your financial and business matters. While powers of attorney take effect immediately, the intent is that they're not going to be used unless the principal needs help or becomes incapacitated. So your power of attorney or your attorney in fact will be able to sign the admission paperwork, pay bills, and manage your financial and business affairs while you're too sick to do so for yourself, or if you're held up in a hospital. So this is obviously a very important role, and you'll be giving the person that you name in the document a great deal of power and access to your finances. So if clients are sometimes stumped on who to name, I always tell them that a potential agent's integrity is much more important usually than their financial expertise. And the last thing I'll say about powers of attorney is that this document is only as good as it functions in reality. So banks and other financial institutions vary and sometimes place hurdles in the way that the document can be used. So it's important. The number one thing is keeping it current, having an up-to-date power of attorney, and also it's important to check with your banks and other financial institutions to make sure that they don't have their own specific power of attorney form that they require, and to make sure that you sign that in advance as well. The next document that's equally as important is your healthcare proxy. Similar to the power of attorney, you're appointing someone to stand in your shoes, but this is now to make healthcare decisions for yourself if you're unable to communicate those decisions. A good medical decision maker is someone who can talk to your doctors both in person and over the phone, who knows about what you want and what you do not want, and someone that you trust to follow through with your wishes. So, and how does your agent even know what your wishes are? Audrey and Joan touched upon this. It's important to communicate with whomever you appoint as your healthcare agent. Often clients will mention, well, what about my living will? And living wills are documents that provide instructions about your healthcare wishes, but they're not legally recognized in Massachusetts. So the solution, what we do is put your directions right into your healthcare proxy. So this is often called your medical directive, and it states what your wishes are in different situations, and it can be very helpful to certainly talk to an aging life care manager, to have your family sit down with one and get the conversation going and continuing. There's also other resources, sort of workbooks that you can use. There's 2 that I've worked with, 5 Wishes and one that's called Your Way, and they are very helpful in laying out one's values and what one's wishes would be in different situations. The last thing I'm going to say about healthcare proxies is that if you have a solid, well thought out healthcare proxy, you should absolutely not sign one that the hospital may provide you with to sign. Their simple 1 or 2 page form will supersede or nullify the comprehensive and well thought out healthcare proxy that you hopefully have already in place. Now, along with your healthcare proxy, it's also important to have a HIPAA release. There's always a HIPAA provision that I include in my healthcare proxies for clients, but it's important to have a separate HIPAA release because the HIPAA is effective immediately, and you can name more than just your healthcare agents in this. You can name many people to receive information about your care. It just allows medical providers to communicate with those people. It doesn't give the people you name any rights or powers. So what these 3 documents do, it'll help your family. It'll ensure that your decisions can be made for you, and it'll avoid the need for a guardian or conservatorship. It's important that these documents are in place and that you confirm that they are adequate to avoid having to go to court and go through a legal proceeding to ensure that decisions can be made for you. The last thing that you or a family member would want to do on your behalf is to go through, get the courts involved, go through a legal proceeding. It can be expensive and time consuming, and it'll take away from your ability to be there for your loved one that's sick and actually spend time and care for them.
Great.
That's what I have to say.
Okay, thank you, Christina. That was a good overview. Next, the final section on this is the financial information. So let me introduce Olga Okati. Olga Okati is a principal and director of financial planning at Centerpoint Advisors, a full-service wealth management and investment advisory firm in Needham, Massachusetts. Olga specializes in working with multi-generational families and closely held business owners to develop integrated, thoughtful planning and investing solutions that address her clients' complex needs and gains them invaluable time. Olga, take us through the financial information section, please.
Thank you, Rich. Thank you so much, and good afternoon, everyone. So in this next section, we'll address the items your trusted financial decision makers or agents will need to keep your financial life running smoothly while you're at the hospital. And these types of suggestions will provide them with an organized, well thought out blueprint to keep your affairs in order and make sure nothing falls through the crack. So the first place to start would be with a summary of your account numbers, usernames, and passwords. And most typically you provide this kind of information and level of detail for your bank accounts and credit cards just to ensure that all bills are paid on time. And you can also choose to provide this type of information for your other assets. The important caveat to keep in mind is that most financial websites and institutions now require dual-factor authentication to log in, and this typically takes the form of a unique code that's emailed or texted to you to get into the account. So it's very important for your agent to be able to reference this code to access your accounts. And the way to do this is to set up your agent's email or cell phone as one of the options to which the code can be sent. So most financial websites will allow you at least 2 methods of delivery for that information. So you would retain your own email or cell phone as the primary method, and you would set up your agent's email or cell phone as the secondary method for delivery. And this can be typically found either in the profile section of each website or the security setting. In addition, you would also provide to your agent a summary of your investment and retirement accounts, as well as any pensions and annuities. And the easiest way to convey that information would be through a recent account statement, so either quarterly or monthly or annual if a more frequent one is not available. And this will have all the information your agent would need, including the account number, registration, holdings, cost basis, custodian, where the assets are located, that sort of thing. Related to assets, it's also very important to provide your agent with any trust documents for any assets that are registered and held in trust name. These documents will help your agent identify the trustees, successor trustees, and any special distribution provisions and parameters to ensure that these are followed and your wishes are executed, whether it's for your own benefit or that of your beneficiaries. Next, you should also make a list and provide information regarding any business interests, private equity, notes, receivables, and any other investments you have that typically don't have regular statements or reports provided to you. So it's important to outline these and capture them in your records for your agent. Of course, you'll also want to provide information regarding any liabilities, debt, such as your mortgages, any auto student loans, any family or personal loans you have, just to ensure there's no accidental late payments or any delinquencies. And a simple way to do this would be also just to reference the last monthly statement available and just set it aside in the file for your agent. You'll also, it would be helpful for your agent to have your recent Social Security benefit statement. That is easily downloadable just on the regular ssa.gov website. You can sign up for an account and download it as a PDF. Also, to provide your life, disability, and long-term care insurance policy information. Most insurers will send an annual summary, and you can provide that. And last but not least, it would probably be very helpful for your agent to have the contact information for all of your legal and financial professionals, such as your CPA, your attorney, your financial advisor, daily money manager, insurance agent, and for any business owners, their business advisors and the business team. These professionals will help your agent navigate any challenges or concerns that may arise as they're managing your daily affairs, and just to provide an additional level of support for them to navigate. So we realize this list is quite comprehensive and may seem a little bit excessive if you're simply looking to designate someone to manage your life for a few weeks while you're at the hospital. But if you have an extended stay or if there are any sort of complications, this type of information becomes really important. And as Christina mentioned earlier, in any type of a health emergency, the last thing you want to be doing is running around and chasing paper trails and arranging cumbersome logistics for this type of information. You really want to be able to have the time and be present to spend time with your loved ones and have all your mental and emotional energy directed there. So before I wrap up, I would like to turn the discussion to my colleague Jeremy, whom you met earlier, the daily money manager, who has a few additional insights and takeaways he'd like to share with us. So Jeremy, please take it away.
Thanks, Olga. And what I'm going to talk about is how you manage your day-to-day while you might be unavailable from doing it yourself. So to take care of your daily financial needs, it's important to identify someone you not only trust to handle the administration of your financial income and obligations while you are out, but also someone who has the skill set of being detail-oriented. And what you can see from the list is these are the most obvious places where cash flow is going to come in and out in your daily accounts and what needs to be managed. So if you were going to give this to somebody, you might want to start making a list of those cash flows from the most likely sources: checking, savings, credit card. What's their usual amount? Are they billed to you on paper or electronically? And do you auto pay it, or is it a manual payment? Try to anticipate avoiding a cash need and transfer up to 60 days of liquidity needs from your savings to your checking account so somebody can effectively manage this for you. Provide your trusted someone a house key and maybe an alarm code if it's applicable, so they can pick up the mail and pull out important pieces of the mail, like documents that arrive that just can't wait for you to come back. In conclusion, making sure a trusted decision maker can execute the day-to-day essential tasks will reduce anxiety from a potentially stressful time while keeping your payments on time and your credit worthiness in a great place. I'm now going to pass it back to Rich, and we're going to talk about the rights of patients.
Great, thank you. I just want to point out we're running very close on the end of the webinar, so we're going to go over patient rights briefly, and also Joan, if you can do yours briefly as well, just so we can conclude and get to Q&As. So just hit the highlights, please, and we can certainly do a follow-up webinar afterwards if anybody needs to. So go ahead, Christina.
Okay. All right. I'll just say a few words about patient rights. Hospitals are unfortunately not only influenced by clinical guidelines, but by reimbursement guidelines as well. And all too frequently, patients and their families are not familiar with their rights under both federal and Massachusetts laws. So often hospitals will begin the discharge process on the day that a patient is admitted. And every patient has a right to appeal a discharge if he or she feels unprepared to leave, but very few people understand that they have a right to do this. So the most important piece of advice that I can give is to make sure that the patient or the patient's agent or close family members read every document that the hospital hands them as soon as possible. Don't assume that there'll be time to read it later. There's always a right to appeal decisions, but there's time restrictions to those rights. So it's important to read those papers as soon as possible. And I'll just say, even when hospitals are correct in discharging patients because they no longer require that acute level of hospital care, so often left unaddressed is how they're going to safely discharge a patient. So both federal and Massachusetts laws, again, provide processes to do this, and knowing your rights can buy patients and their family members a few extra days to get stronger and to arrange for care either at home or in an assisted living facility or in the best rehab facility possible. So Joan is going to talk to us about what happens after discharge. What are some of the options?
Thank goodness. Discharge planning in 30 seconds or less. So obviously, I'm just going to give you an idea of what might be out there. So the options for care for adults. So as care managers, we work with the teams of discharge planners and hospital medical providers to layer in the unique supports that people need depending on their discharge needs. And we do speak their language, and we can put up our hand and push back if we need to, because it's all about a safe and well-organized discharge. The types of care that are available would be through insurance and also private pay. Visiting nurses offering skilled nursing, sometimes physical therapy and occupational therapy is usually insurance-based. Private duty nursing, if people don't qualify under their insurance, through agency. Private non-medical caregivers to help with daily living tasks. Skilled nursing and rehab facilities, assisted living communities that can be used for short stays, post-rehab without a post-hospital without a long-term commitment. And then of course, hospice care, which is a benefit that can follow people into multiple settings. I just want to say really quickly that we did include in your handouts a CDC coronavirus discharge planning handout, and that things are opening up and things are better in facilities. I know people are hearing horror stories, but all of our providers are now under mandate still with the state of Massachusetts to do things in a certain way. And things are better, and certainly reaching out to all the experts on the panel. You don't have to go it alone. I think that's the message, that there are many people, many of us who can help you.
Great. Okay, thank you. That's our material. You know, we're gonna take Q&A or anything from the chat that anybody wants to say. So if anybody wants to just unmute themselves, feel free to ask questions, and then I will just draw some concluding remarks at the very end. So we have a little extra time to do Q&A, so feel free to jump in. Anybody have any questions?
If you have a question and you don't know how to unmute yourself or anything, you can also click a little blue hand at the bottom of the if you click on the participants box, then there's a blue hand in there and you can raise your question and we can unmute you. Or you can just raise your hand in your picture and we will, we're happy to unmute you with that too. Okay, Catherine Parente, I'm gonna unmute you, Catherine, so you can ask your question. There you go.
The form that I forgot the name of it, the form that you had there for Massachusetts, is there a similar one for Rhode Island?
So I think you're referring to the MOLST document.
Yes.
And they do have a similar, but it's not the one we've given you. So you'd have to go online to print it out, but it's medical orders for life-sustaining treatment.
So that's what I would search for?
Yes, in Rhode Island.
Okay. All right, thank you.
You're welcome. And I think there was a question earlier on, someone had asked about what if your DNR, your do not resuscitate documents, don't align with your MOLST documents. So I will let the attorney in the room answer some of this, but that's not an uncommon occurrence. And what most clinical treaters are looking for now, especially if you go to the hospital, is this MOLST document, as opposed to some of the older forms that Massachusetts used before. So the next time all of you see your primary care physician, this is the time for you to update with this document. Christina, is there a legal answer to this as well?
So if there's two competing documents, it'll be the document that was most recently signed that governs.
Also, Christina, I saw that you addressed a question on here from Bonnie Johnson. Said, if you don't have a healthcare proxy and or power of attorney, does the spouse have the authority? And you wrote, no, Bonnie, that's a common misconception. A spouse does not have authority and does not. Can you expand on that a little bit?
Sure. So a lot of think just because they're married that their spouse has access to accounts that might just be in that spouse's name, or will be able to make healthcare decisions for them. And if they're lucky and they're working with doctors that know them, then they might get away with it and not have these forms, but it's not something that you want to risk. Married couples, spouses, absolutely need to have a healthcare proxy and power of attorney appointing each other, if that's what they choose, to be their agents, to receive information about their care, to make financial decisions. All too often, we have to go to court to have the healthy spouse appointed as the guardian and conservator, whether it's to change title to the deed to the healthy spouse only, or just so that the healthy spouse can make ongoing medical decisions for the spouse hospital. So it's very important to know that just because you're married doesn't avoid these documents.
I also invite other people. I see Stuart Parsons has a question. Stuart, you want to unmute yourself?
Sure. I just wanted to ask Christina, you mentioned earlier that the healthcare proxy, not to sign a hospital form. And my question is, do the hospitals typically look for that form with you in your emergency bag?
Good question.
Or are they just going to force a form on you right away?
Right. So it depends. There are times where you'll go to the hospital and whoever's there will just immediately hand you a form to sign, a healthcare proxy. If you don't have one right with you right away, to give them in your packet. A lot of people have them, they just don't have them with them. So it depends on the hospital personnel, and if you go somewhere that's does things the right way, they're going to make sure that that you have one. If you have one already, they're not making you sign a new one. So does that answer your question?
Yeah, I'm just, there's always what you don't want to think will happen, like you're immediately incapacitated and
That's right.
to a situation like that, and someone's just trying to do their job.
Well, that's the thing. If you're incapacitated, you're not going to be signing a healthcare proxy. It's too late at that point that you become incapacitated. So if the hospital doesn't think you have one, they'll initiate these proceedings on their own. They'll initiate a guardianship or conservatorship proceeding so that they can make sure that they're treating the patient, able to treat them appropriately and have permission, that they're able to discharge the patient, because if there's not a guardian appointed and no one has a right to say where the person can go, they're going to be stuck with this patient that they're not getting reimbursed, potentially. They're not getting paid to have at their hospital. And lastly, they'll have a conservator appointed to make sure that they will be able to be reimbursed, that they have all the insurance information and that they'll get paid. So, and I've seen it happen where clients have healthcare proxies and powers of attorney. They weren't done by me, they were done by somebody else that are not great, and they're not sound documents. And what happens is a hospital will just go right to court and sometimes not even tell the family, or if they don't, they'll use it as an excuse if they don't like the healthcare agent, or if the healthcare agent is being too pushy about certain things. I've had so many, unfortunately, it's happened so many times where hospitals will try to take things into their own hands and disregard these documents. So the first and foremost, it's important to make sure you have them in hand in your essential medical folder when you go to the hospital.
Thank you.
And on your refrigerator, because we do have in Massachusetts, all EMT drivers, 911 drivers are trained to look for this. So I can assure you, as a former ER social worker, I can tell you that treaters don't typically look for these documents. They'll take them from you, but they're not looking for them. They're going to hand you a new form and tell you to just sign it. But there is a move in the state to really get planning done, which is why they have these most documents and why the pink form is a must. So if you can keep it on your fridge, that starts the process with the driver.
Great. Joan, you had your hand up too?
Yes, I just wanted to make a very quick point that although we're talking about going to the hospital alone, when people are in end-of-life care, they are allowed into facilities such as nursing homes and assisted living that are currently not allowing visitors. They are allowed in. So I just wanted to make that point.
Great. Bonnie, I see you have your hand up, so if you want to mute yourself, please share.
I'm wondering about with COVID-19 if the kinds of measures, wishes people have for care have changed. So the one person I had to do a most form with, he didn't want heroic measures, but I would have called going on a ventilator for 10 or 15 days heroic before, but I'm not sure I would now. So I wonder if you've seen a change in that.
Yes, actually, I had mentioned, about my 82-year-old and the vents. I think that COVID-19 has really changed some of these nuances. There is a lot of conversation on end of life now, different websites about intubation, extubation. There is talk about putting in an amendment on the MOLST document. It hasn't been determined yet, but there is talk about doing that because of COVID-19 and all of the event work that we're doing. The other thing that my colleague wrote, I hope you all saw it on the chat, is that they are now taking, Joan had mentioned, they are taking virtual signatures, as many of the attorneys know, for some of these documents as well.
Great. Chris Hawthorne has his hand up. Go ahead, Chris.
We're short on time. Thank you for doing this. This is phenomenal. And I'm sorry to bring up such a dark point, but I wonder if anybody's got advice on the issue of when we're dealing with separation and divorce and children. And one of the things that we've seen is that we're getting to some pretty nasty territory with children, and I can only imagine what it would be like to have a power struggle. Is there anything specific that should be on the refrigerator or in the file, or is there anything a parent can do to lock and load to make sure that this is addressed? Thank you.
So the most important thing to do I'm assuming you're talking about a child that's over the age of 18. No.
Under
18. Okay. The parents are going to have to work together, if at all possible, and the parents should, if one of them's unavailable, the law says that the other parent is going to be the guardian and caretaker for the children, and it's very hard to change that. You'd have to show that the children are in danger and not able to be with the other parent. And so is that what you were asking? What to do if you go into a hospital and what happens to your children?
Not really, sort of.
Chris, I'm going to interrupt for just 1 sec. This is Joe Chatham. Some people are starting to sign off. It's perfectly fine to continue this per our conversation earlier, but I just want to invite, if people have to leave, we understand. But Christina and Jeremy and Rich and the whole crew from Special Needs and Elder Care are happy to stay online and continue, with this conversation. Jeremy, I'm going to make you I'm going to make you the host of the meeting because I have another meeting I have to jump into. So good luck, everybody. And you know what? Thank you. I would ask that all the participants that spoke today, in the chat box, please put your contact information so that if anybody on this line has, this is, these are the rabbit holes, right? It's a lot, very complicated information that they can reach out to you individually and ask, and get some feedback if they need to. So in the chat box, please put your contact information and your name. Thank you. And Jeremy, did you receive the host invitation? Just thumbs up if you did.
Oh, unmute, Jeremy.
I did not.
Might take a second.
Okay, go ahead. You guys continue talking, Jeremy, and it shows you as host, Jeremy, so I can sign it.
Go ahead, Chris.
Thank you. So what I was thinking is that it's one thing when an individual fills out the MOLST or even a guardian, but when you have these decisions have to be made ahead of time, or assuming we should have decisions made ahead of time for children if something happens to them and they have to go in, and then I can just imagine the melee that could ensue as a marriage is breaking up, and it could put the child in harm's way in terms of, because I'm assuming the doctors are going to back off and say, you know, we're not going to play judge here. So that's a foreseeable event. I'm wondering if you've got any kind of documentation that you can prepare at least one of the parents to be ready. God forbid.
Almost seems like we have to have a divorce attorney on.
Right, right. So this is definitely a sort of custody issue, because both parents, again, are considered to be the legal guardians for their children under the age of 18. And if they can't come to an agreement about the care for their child, then they will have to go to court, and a judge will make that decision, will decide for them. And you know, the doctors, they can't take one parent's side over another, and there's nothing that you can really plan ahead for that, because you again, you're both the legal guardians. So you know, if there's disagreements, then it's something that has to be worked out, and if you can't work them out, you're going to end up see yourselves in court.
If I can just add to that a little bit. So, you know, typically if there's two parents who perhaps have very different views on the type of treatment that might be suitable for their children, and you know, there's obviously going to be provisions in the divorce agreement, the custody agreement, about certain decisions and making them together, but it may not be a bad idea ahead of time engaging perhaps a mediator, a divorce mediator, to help you work through these issues and decisions and scenarios ahead of time, to be prepared, so that if there is a situation, you're not making decisions in the midst of panic and gridlock. And then you can always, you know, modify any agreements as needed, or have an outline of a step-by-step, you know, this is what we agree upon, and if this happens, this is what we'll do. And a mediator can definitely help work through that.
I'm sorry to interrupt. Apparently we have to end because there's another practicum waiting to get on. So I'll just summarize. Thank you, Olga, for that answer. The new normal is a constantly moving target. So, you know, the Elder Care Consortium is here to provide timely answers. You can contact us by getting a hold of us at ecresources@usa500clubs.com, and that'll go right to me, and I can sort it out amongst the group. When we're asking people to dig into like their very personal information, having two sets of eyes on the prize is a good way to do it. So in my family, my sister and I work on my mother, who's 91. We have our specialties, but we both know what each other is doing, and it's a good way of kind of sharing the load a little bit. Chris Hawthorne, who is on here, knows that this isn't just about COVID-19. His daughter very recently just went to the hospital alone, and it was a very scary prospect. Fortunately, he had the backing of USA 500, but you know, that doesn't exist in every situation. So this is a real situation. I think we're out of time. What we're going to do is we're going to send to you some follow-up documents and a survey, and we'll give you a little bit more information at that time. I appreciate your attention, time. Sorry, I'm rushing at the end here, but